Hello, everybody. My name's Raj Agarwal, and I'm thrilled to be joined here today by Tami Erwin, Executive Vice President and CEO of Verizon Business. And our topic that we're going to talk about today is 5G in healthcare. Just to put this in context, my background is as a clinician, as an innovator. I have a PhD in virtual reality and robotics, and then most recently working in a company called Panda Health, which is really around how do we bring digital health to health systems across the US. So I'm thrilled to be here with Tami today, and really looking forward to what we're going to learn and what she's going to share with us around 5G in healthcare. So maybe Tami, if you could just expand a little bit on your background, and then we can get into a bit of the discussion.
Absolutely. And Raj, thank you so much for the opportunity to join you in this conversation today. My background, I've been in telecommunications now for nearly 35 years. I started as a customer service rep and thought I would do the job for a couple of years. And then when I grew up, I decided what I wanted to do. And what's happened is technology has changed around me, and every day has been a new learning opportunity as we look to really use technology to solve some of the world's biggest problems. Today, I operate our Verizon Business portfolio for Verizon. It's a $32 billion business. I have employees in 50 countries around the world, and we serve 99% of the Fortune 500 businesses. So really exciting time to be in tech as we think about 5G. I would also tell you I have a tremendous personal passion around this topic. I grew up in a small agricultural community north of Seattle, and my father was a family practice physician. And I remember as a child doing many house calls, and we had nothing for technology short of a stethoscope. So it's a pretty exciting time to see technology really change and transform for healthcare, for really patients, physicians, and administrations around the world.
Wow, Tami, that's an impressive background, and I didn't know the piece about your father being a physician as well. So that excites me even more. What we're going to hear today. So let's just kick this off, and if you could just kind of maybe level set and share with the audience from a high level, where are we in the adoption of 5G right now, and why does it matter?
Yeah, so I think we are at an exciting time with 5G, and quite frankly, Raj, if I step back and think about 2020, in so many ways, the lessons of 2020 and COVID have really scaled and accelerated the adoption of 5G. Let me just take a minute. Verizon was first in the world to launch 5G mobility, first in the world to launch 5G fixed wireless access, and then first in the world to launch 5G mobile edge compute, which is a really exciting component of 5G because it does give us access to capability and functionality we haven't imagined before. I think the other really important part here is there's a lot of conversation about what 5G is and what it isn't. We think about 5G nationwide, which is really our 4G network with capabilities of 5G, so DSS capability, and really bringing the capability of the network to about 2/3 of Americans in terms of 5G NR. And that provides great coverage capability. But when you think about 5G on millimeter wave spectrum or 5G UWB, we talk about it that way, it provides a whole different set of capacity and capability, which is really exciting from an innovation standpoint because it allows us to really think radically different about industrial and commercial use cases and the kinds of things that we can do, AR, VR, AI, big data. You really see where mobility meets broadband, meets compute and cloud. And it's a super exciting time because it allows us and it allows developers around the world to really create a sandbox of innovation that really can be applied against so many things, healthcare being one of those.
That's wonderful. And I'm just going to take a thread of what you said a few moments ago, that this innovation backbone, the technology piece is so important. But as you said, even when you were growing up and when I was training to be a surgeon and doing all of this research, and one of the things that really frustrated me was I was doing this groundbreaking research with these companies, and we were producing the science, but it wasn't actually getting applied, right? And what we've seen in the last 12 months with COVID is a real adoption and realization of virtual care, and also just in our other lives, just more virtual, right? So why is now the right time, and what's the onward potential for 5G to be a game changer in care delivery?
Yeah, I love the way you think about the what do we do now, because you're exactly right that last year created an opening for disruption that we might not have otherwise seen. And I think about when COVID hit and everybody had a need to see a physician and they didn't feel as though they could, the entire ecosystem for healthcare opened up. And it said that whether you're a patient, whether you're a physician, whether you're an insurance company or you're an administrator, you now found yourself in a place where creativity and innovation had to happen out of necessity. And we found ourselves in a position. Verizon acquired a platform last year called Blue Jeans. It's a video and collaboration platform. It's incredibly secure, so I love that component of it. And we saw millions of hospital visits and healthcare provider visits that were done via the Blue Jean platform. And one of the things that had to happen in doing that was to make it very simple for the patient. Send the link, click on the link. Most patients know how to do a text message protocol. So click the link and you're in your doctor's office. I think that's the kind of real-time innovation we saw happen in 2020, where patients were able to see their physician. And it's interesting, as I talk to big healthcare providers, what I'm hearing is 80 to 90% of general visits today are being performed via video, and 40 to 50% for specialties. So when you begin to think about how do you provide greater access to patients that are sick or patients that might not have access to specialization in their community, I think it's opening up new doors. And what we found last year is that insurance companies were all of a sudden willing and ready to pay for that service, which meant physicians were able economically to provide that. Administrators were willing to pull it into an ecosystem. And so I think our opportunity is as biometrics get even better. I think about wearing my Apple Watch, it checks my heart rate, it checks my oxygen. Why wouldn't I allow that to be part of my healthcare records? And then healthcare records are on file. It's easy for a physician to be able to use that information to better diagnose a patient. And I think we really build from the basis of what we saw in 2020, which was really a virtual visit, to now what can be a much more sophisticated visit and a much more complex healthcare profile that I think will enable not only better care, but perhaps equal care for people that might not otherwise have access.
That's such an important point, and I love the way you frame it around what's happening today. But let's flip a little bit into the future as well. I mentioned I did my PhD 20 years ago in virtual reality, which was a really exciting time, and now it's even more exciting. And so some folks will be hearing about augmented reality, pre-procedure rehearsal, this kind of stuff. And that's really, I would say, still at the leading edge of how we're thinking about technology in healthcare. So can you talk more about how 5G is going to support, and more than support, actually help us disseminate augmented reality for the care of our patients?
Yeah, I think we're going to see some pretty terrific use cases where augmented reality is applied in the healthcare environment. I think about first and foremost diagnostics, the ability to more accurately and quickly diagnose patients with the disease. And we're going to see a video here in a minute that shows an example of a physician that's able to use the low latency capability of 5G to quickly identify a polyp in a patient that they would not have otherwise seen because of the real-time nature of the capability to visually see something you might not have otherwise seen. The latency capability of 5G is sub 10 milliseconds. So when you think about how quickly you can process that information, you begin to think about low latency applications for augmented reality. You think about it not only in the diagnostic capability, you begin to think about it, everything from imaging and the ability to clearly see images remotely, so the ability to pass information to physicians that may be specialists that need to see and examine, imaging capability, really important. And then the ability for us to really think about, 3D holographic renderings of CAT scans, and so a lot of work around imaging and diagnostics. I think that's where we will see it first, is the ability to really clearly identify and diagnose a patient. I think then as you get into the treatment protocol, you'll begin to see some of that too, as you begin to think about edge compute. I think there's another component of it as we think about genome mapping and the ability to have personal mappings for people's treatment plans the ability to capture data, the ability to compute that data on the big compute platforms that will be at the edge because of mobile edge compute. And as we begin to think about mobile edge compute, I think it's an important distinction to understand that hospitals, as an example, I think will be a perfect use case for private networks and then private edge compute, because they'll have the ability to customize the applications. They will be very, very secure. And you could have a capability that you use for physicians and staff and a capability that you use for patients, so you don't blend the two. So I think you'll really begin to see it around diagnostics and then really around personalization and personalized treatment plans, because you have the edge compute capability right there on premise and the ability to compute big volumes of data to really get to options and choices that physicians can then use in their treatment protocol.
I love how you're thinking about this, Tami, from the diagnostic side. I remember looking at MRI scans, and is it a bit of fuzziness here or fuzziness here? Yeah. From the interventional side, I actually say this when I'm in the operating room. I'm using these 45-year-old hands and these 45-year-old eyes to do this surgery. My car probably has more sensors in it to be able to drive better than I can do this complex surgery. And then specifically on that kind of these private networks, there is so much data out there, and creating this approach to having a learning healthcare system where we're actually making use of all that data, I think is absolutely remarkable. So thank you for sharing that with us. I think you have a little video to share with us where that's being applied. So I'd love, if we can, to take a look.
Hi, I'm Raj Nair. I am the co-founder, chief scientist, and acting CEO of Avacia Systems. We build a platform for accelerating edge applications. The trial we're doing with Verizon and AWS is about using AI to help endoscopists more accurately detect polyps in real time.
I'm Dr. Shannon Scholl. I'm a gastroenterologist in Raleigh, North Carolina, and a physician owner in Raleigh Endoscopy Center. One of the problems that gastroenterologists like myself face is finding these very subtle polyps. The purpose of this trial is to use 5G, AI, and the edge to put another set of eyes on that. Colonoscopy moves very, very fast, and I really need a computer program to keep up with me. I can't wait 2 to 3 seconds. So the really vital thing about this technology is the speed.
It works by taking the video feed from the scope, sending it through the 5G network to the wavelength node, where the AI model is trained for identifying different types of polyps. And the results are then sent back in real time to the monitor of the practitioner.
So what you're seeing here is the actual high-def monitor that I'm looking at during a colonoscopy procedure. And the neat thing about this program is that it's drawing bounding boxes around this polyp in real time. And they really draw my attention to this sort of pale, flat polyp that's trying to blend into the background. Might not have otherwise seen this.
The system, if it is not fast enough, will actually miss drawing boxes around the polyps in real time. And that's why you need Verizon's 5G and AWS wavelength to give you that low latency.
The thing that really excites me about this technology is that I think it's going to be really important in the prevention of colon cancer. It improves accuracy in patient outcomes. It's going to be the standard of care, and it's going to be accessible to everyone, and that's good medicine.
So Tami, that was a remarkable video, and it really does, taking your words, need to be the standard of care across all our patients. We've already mentioned it, but let's go back to virtual care and the acceleration of telehealth. And I know when I was in my own health system last year, we were doing maybe 100 or 200 telehealth visits a month, and that went to many thousands or even tens of thousands of telehealth visits, and that happened in days, like literally. There seem to be indicators that there's going to be a permanent shift, that we're not going to go back to those 100 visits a month and so forth. But I'd really be interested in your thoughts on where Verizon is driving that value add right now.
Yeah. So I do think we will scale very quickly from hundreds to thousands to millions of visits. And I think our role at Verizon is to really make sure that as we think about providing great connectivity for customers over secure platforms that enable you to have the confidence of excuse me, having a great conversation with your physician as though you're in the room with the physician and really feel like you've got that personal connection. And I think the ability to create simplicity in the tools, to create commonality in the ecosystem will be what makes it really important for easy adoption. Because I think the key will be, how do we make sure that for the physician, it's easy and it's simple, that the physician has as much data and information as they can to simplify and serve the physician better so that they can make a better diagnosis, that the patient has the confidence that they're not just a number, but that there's a personal connection there as well. And so we're really working on connectivity, simplicity, security, and then really some standards for the ecosystem so that as you think about things like records and adoption for insurance companies as well, so the patients know that that visit will be paid as well, because that has been a lot of the hesitancy is the adoption is, will my physician see me that way? Will my insurance company pay for it that way? And will I as a patient feel like I was respected and diagnosed accordingly? And what I think it does is creates an ecosystem that then says, if I need to send my physician a quick note, I can do that simply and easy through an electronic system. And I think ultimately that's the role we see. We're also working in our innovation labs. We have 6 or 7 innovation labs around the world right now. And those innovation labs work with developers, like you saw with the example in the video, to bring developers into our lab and say, if you have a use case that's not only for diagnostics, but also for patient treatment. You talk about robotics in the OR, certainly that's a big use case. You think about EMTs and some of the emergency management that is performed in the field in ambulances or kind of on the field. We believe there's a huge use case there to be able to provide good diagnostics on an emergency management standpoint so that when the patient gets to the hospital, that there's good information. So consistently core connectivity, security, and simplicity around the transactions.
Now, I love that you call out the trust between the patient and the provider. And going back to what you said even at the beginning of this talk about the house calls, and that's how that trust used to be developed. And I remember when I was growing up, it was about having one doctor from cradle to grave, and they knew your mother and your grandmother, right? And I think the kind of technology that's come into health systems recently has very much been kind of the electronic medical technology, which has, made it more clunky and eroded that trust. And so what I'm really excited about, and you talk about this, is it's trust on both sides, though. It's not just the patient trusting the provider, it's the provider being able to trust the patient as well in terms of how they're doing with their healthcare and being able to have all that information on hand right in front of them that they need to be able to deliver that best care.
Yeah, I think that's so true. And that relationship with the physician, I love the way you go back generations, because in my family, that's exactly what my father did. He delivered babies, he took out appendixes, he fixed broken legs, and he knew everyone in the community. And there was a relationship anchored on trust. And if we deliver a simple transaction that patients can feel good about, then their time is spent with the physician being open about the problem, creating a treatment plan, and being able to really then create a healthier community. I just think that's so important. I think the other place where we're seeing innovation really happen is around education and really how do you continue to train clinicians. I have a niece who's in med school right now, and she's, in many ways still using the same textbooks that my brother used when he went through school. And how do you use an interactive experience, think about AR, VR capability, to really create a training experience that allows these young med students to come out much more educated and much more aware so that they can concentrate their time on some of the bedside manner components, learning to be good listeners, learning to be good physicians from an artistic standpoint as well as from a scientific standpoint. And if we can use technology to create an immersive experience so that you enhance their learning experience and they're a little more qualified when they go to the bedside of a patient and prepared for that environment.
I think that's so important. And even in my training, when I was teaching residents, medical students, would bring them to the simulation lab and they'd spend an afternoon there. And I remember one of them told me, Dr. Agarwal, I've learned more here this afternoon than I've learned in the last month at the hospital, because this is actually focused on me and the technology is around me. So I love that. That's great. I want to talk about another topic. We've talked a lot about technology. You mentioned communities, but there is concern about underserved populations and having access to such technologies. And we've heard a lot about the digital divide, even in the last 12 months or so. And unfortunately, a lot of those folks that don't have access to the technology that you or I might have are the ones that need the care the most. They're underserved, not only in terms of technology, but also in their healthcare. So how does that fit into the Verizon strategy and to address that?
Yeah, Verizon has taken a very strong position around network as a service, which says we build a big network capability and we build different brands to meet the needs of customers. We've recently announced our proposed or intended acquisition of TracFone, which is a large wholesale provider today, in which we anticipate serving a lower value segment with the same great network that we serve our other customers with today. Verizon is known as a premium brand and oftentimes viewed as available only to premium customers. By opening up and broadening our network as a service, we find ourselves in a position to serve everyone. And we think that network capability should be in the hands of anyone who needs it and who wants it, particularly as you begin to take basic use cases like healthcare, like education, and take them out broadly to the masses. And that's what I love about how we're building out 5G NR and 5G UWB, because it really allows you to have 5G nationwide to run the basic capability that we're talking about today, and then to do some sophisticated capability in places like hospitals, where you might put a private network in, where you have more advanced capability, where people are going to come anyway. I think one of the things we don't talk as much about right now is the aging population. And as you think about an aging population, how do you make it simple and easy for them to maintain independence as long as they can, and have a quality of life where you can take basic capability that should be available to everyone, and be able to take a tablet and create a very simple portal interaction for a patient to be able to connect with their physician. And what we're doing with 5G NR and 5G UWB provides for both coverage and capacity and capability. And then by using network as a service to serve multiple customer types, we really open that up broadly to serve everyone. And we think that's super important when you think about just the basic functionality that connectivity can provide.
I love how you're thinking as well, and it's such an important part of where we are as a society as well. As we come to a close, I'm really enjoyed the conversation, but time is almost on us as well. I'd love to spend a few moments on your insights on what will accelerate digital innovation and what we've learned, and I want to focus this on not what's many years away, because when we talk about the future, it's always, okay, that's the cool stuff, right? That's what the cool kids are doing, right? How does that relate in terms of your vision for 5G in healthcare to what may happen in the next few months, or even through to the next year or so forth? What may already be happening that others may not be aware of?
Mm-hmm. I think it's such an important way to think about it, because I think about the last year, we've all reacted and responded to COVID, and we found a way to get by. I think now it's about, over the next 12 months, really reimagining things like the doctor's visit. So we found a way to do a doctor's visit. It was a little clunky. We really didn't get into a rhythm. I think the next really 12 months are about making it simple and easy and accessible for everybody to do a virtual visit. And then I think you move from there into some of the diagnostics and the biometrics capability that will begin to feed into patient portals and information that will become available for both a patient as well as a physician. And then I think you're in a permission space to really dream big about how you use technology to change patient outcomes. And you do that by empowering the physician to have better information, use technology to diagnose and to treat patients, and then really use it in the clinician community to train. Because you think about how rapidly technology is changing, how rapidly treatment is changing, Look at the last year and how quickly we created a vaccination. You think about how fast that's training. How do you keep clinicians current with everything they're learning around the world to really then provide what I think will become very personalized treatment plans? I hope they're more proactive treatment plans than reactive, because I do think that's where we will go as a society, is how do we make sure we've got a better structure for healthy living? And so you use devices like my watch, which says you need to breathe, you need to get up and move, and then that feeds into a really healthy living lifestyle. So I think the now is simplify the clunky and then dream big about how you use technology to really provide great diagnostics, great treatment, and great personalization of healthcare, and make it easier for physicians. Physicians carry a heavy load. They're patient to patient to patient to patient, oftentimes don't have the time to stop and breathe between. I think providing better information so that the physician can really focus on a treatment plan to treat the whole person, rather than trying to find charts and information on lab results. You kind of bring it all together and let the physician really play the role they want to play, which is treatment of the patient.
Well, let me just take a couple of threads. First of all, I love that you say about the clunkiness, and I've often said that my job in healthcare innovation is to get rid of the clunkiness in healthcare. So love that we're aligned there. Just talking about the patient physician, patient provider relationship, we've kind of touched on that a few times. And another colleague of mine who's not in healthcare said, why is healthcare so behind? Like, we do everything on our smartphones right now, whether it's booking a holiday, whether it's booking a restaurant, a hire car, whether it's looking it up. You mentioned your health fitness app. And my response was, it's a very scary place to be a patient. You are vulnerable. Mm-hmm. And we have this kind of tradition as a hierarchical relationship. And yes, COVID and virtual care has modified that a little bit. But how's this technology, the 5G that we're talking about, the edge computing that we're talking about, from a patient perspective, and going to enable them to own their own care, drive this consumerization of healthcare, which we also believe in?
Yeah, I think it's going to happen in a couple of ways. First of all, I think the system itself has been very vulnerable, and we've seen that over the last year. The lack of a public healthcare system in the U.S. has really, I think, halted our ability to do COVID testing, to have a standard of care, to get vaccines distributed. And my expectation is that we will see a stronger governmental engagement in terms of what are the standards for electronic utilization of data. Because I do think a patient becomes vulnerable. I don't want my information released to just anybody. And I know in my own, and I'm pretty forward thinking about the use of my information with healthcare providers, but you've got 3 or 4 different platforms you're logging into and your information is not all in one place. I do think coming out of COVID, we're likely to find that the government will take a stronger role in trying to stitch together the ecosystem so there is a common set of standards for where is information stored so that it becomes simpler for a patient. The patient then knows that that information is secure. They know that their physician has access to it. They know that's where they go for information. I mean, where do patients go today? They go to Dr. Google. Dear Google, what is wrong with me? Dear Google, what should I get for medication? And so if that Dear Google contact can be with their physician as opposed to with Google based on a secure set of information, HIPAA has been good intentions, but I think it has prevented the common ecosystem that I think is required in a public health system.
Well, Tami, unfortunately, our time is almost up. I really want to thank you for taking time out of your busy day to share with HealthIMPACT the Winter Forum, and really, really the approach that you have in terms of not just talking about your family background of being a family of doctors, but also everything that you've done in technology and how Verizon is really charting this path forward and aligning this with primary care, virtual visits, diagnostics, intervention, and then this whole kind of area around ownership of data and the security of the data. I think we've managed to fit a lot in to the last 30 minutes or so. So I'm thrilled. I've learned a lot, and really, really thank you again, Tami, for your time today. It's been a pleasure.
Thank you for covering this, and thank you for being a physician who's so interested in how you use tech to solve some of these big problems. I think together we'll dream big and we will change how we think about healthcare and accessibility for everybody.
Brilliant. Thank you again.